Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Shahida binti Tayuman and I would like to present my case study titled Multiple Infections and Acute Myeloid Leukemia in Dialysis Patient. We move to the introductions. Multiple infection in dialysis patients refer to the occurrence of several simultaneous or sequential infections in individual undergoing dialysis treatment. Dialysis patients often to have a weakened immune system due to their underlying kidney disease and treatment itself, which involve frequent access to their bloodstream through dialysis catheters or vascular access point. So this is basically where the points of infection started. Dialysis patients tend to have an increased risk of various infections, including bloodstream infections, urinary tract infections, UTI, pneumonia, skin infections, and infections related to their dialysis access site. So basically, when dialysis patients have a weakened immune system, so they're prone to have infections, not only infection, but multiple infections. Third one, multiple infections can occur when a patient develops more than one type of infection simultaneously, or when they experience recurrent or sequential infections over a period of time. Again, multiple infections is very high risk to the dialysis patients. Number 4, acute myeloid leukemia is a type of cancer that affects the bone marrow and blood cells. It involves the rapid growth of abnormal myeloid cells, which are a type of blood cells. Balancing the treatment of acute myeloid leukemia with the challenge of managing multiple infections in dialysis patients require approach involving oncologists, nephrologists, and infectious disease specialists. So basically, when the dialysis patients have a multiple infections and also have a cancer disease, cancer blood disease, so it will require a lot of specialists to involve to receive a proper treatments. Next, the patient have been undergoes matched unrelated donor stem cell transplantation, where the patient had been engrafted with neutrophils, and at the day of 15, she was engrafted with platelet. Next, the patients undergo chemotherapy and having a bone marrow assessment for every session. For the bone marrow assessments, it is used to analyze the percentage of the blood occurs in every session. Okay, means it is for searching for the severity of the bone marrow assessment. Next, the infective histories for the patients were recurrent herpes zoster infections over the lower chest wall, history of Trichosporin asachi, a type of fungal, with pneumonia on 15 October 2020, and have a history of laparoscopic cholecystectomy 29 January 2021 for acute calculus cholecystitis on 29 January 2021. So this is basically the picture of Trichosporin asachi. This is the fungal types of infections, and acute calculus cholecystitis is a types of inflammations at the gallbladder. Okay, because of this patient is a dialysis patient, so basically she is recovering for a type of infection. So means that the first is herpes zoster, and then coming out with Trichosporin asachi, and then also have a gallbladder and some of others inflammation. Okay, move to the lab diagnosis and the result for every period and every assessment. So for the blood culture was sent to the lab diagnosis. Gram stain showed gram negative fruit was sent, and preliminary report blood culture grew gram negative bacilli and was identified as Klebsiella pneumonia, and it is suspected as CRE lah. Okay, from aerobe and anaerobic bottle. Okay, when we see on the preliminary report, and can conclude that there is a suspected of CRE. Okay, and it is just a preliminary report, and we move to the next lab diagnosis. So the Klebsiella pneumonia is a gram-negative bacteria and have a mucoid colonies on the blood agar mucus lactose-positive colonies on McConkey agar, and Lodge and mucus colonies on the clade agar. The biochemical and identification tests that are used in the lab is VTAC2, Malditov, and API-20E. The API-20E has been resulted as per below. So this is basically the further investigations after the blood culturing using the VTAC2. So yes, the result is Klebsiella pneumonia infection. Okay, so the final report showed that carbapenem-resistant Klebsiella pneumonia was isolated from the wide lumen femoral catheter, and this is the final report lah. Okay, CRE. Okay, this is the lab diagnosis for antibiotic resistant. So all those antibiotic is resistant to the CRE. Okay, next further testing was made by sending the blood carbapenemase genes detection CRE to IMR, Institute Medical Research. Method used in this laboratory testing is polymerase chain reaction PCR and microbove dilution. The result presented CRE. The result presented carbapenemase producing carbapenem resistant Enterobacteriaceae and the M gene detected, and the minimal inhibitory concentration for colistin is less than 1. Okay, so this is basically the further investigation that we send to IMR to searching for the correct antibiotics to prescribe to the patient. Okay, move to the discussion. A patient admitted back to hospital due to hemorrhagic cystitis secondary to CMV reactivations and BK virus. So basically, the patient was admitted back because of the secondary infections, okay, recurrence of cytomegalovirus and having BK virus infections also. So this is basically the morphology of the cytomegalovirus, and there is hemorrhagic cystitis occurrence in the patient. Okay, and then acute myeloid leukemia is a cancer of blood and bone marrow. It will affect the immune system, putting the patient at the higher risk of developing infections. Okay, from the cytogenetics and molecular genetics, the patient had a positive translocation mutations and balanced translocation in the features of RUNX1 and RUNX1T1. This acute myeloid leukemia is a part of group of acute myeloid leukemia with recurrent genetic abnormalities. This is frequently seen in the childhood and adults at the mean age of 30 years and rare in elderly patients. But because of this patient having a dialysis and a lot of multiple infection, so these patients also might have a genetic disorder coming from the genetic materials, and that's why the acute myeloid leukemia occurred to be happens in this patient. Okay, next for the discussions of the acute myeloid leukemia, if you see the peripheral blood film, you can saw the neutrophil come out with the blobs. Okay, there is the presence of the large blast with abundant basophilic cytoplasm and often contain numerous azurophilic granulations. Okay, the azurophilic granulation is the dots that is very big, very pekat. Okay, and then our roots are frequently found. Okay, promyelocytes and mature granulocytes with variable dysplasia are also seen in the peripheral blood film. Next, when we are doing a flow cytometry result, also showed high level of CD34 cells, HLA-DR-CD117, with confirmed the diagnosis of acute myeloid leukemia, and it is increased the percentage of the patient to have infections. Okay, once the patients having the AML and the blood cell is not normal, okay, there is the abnormalities to the white blood cell, to the cells of the blood, and we will increase the chance for the patients to have infections, because the white blood cell cannot perform its routine jobs and it becomes abnormal and it cannot perform their routine jobs. Okay, so that's why dialysis patient with acute myeloid leukemia tends to have multiple infections, because no cells can, means all the cells cannot protect the body and the whole system. Okay, move to the next part. Previously, the first infections that the patient had was recurrent of herb zoster infection of the lower chest wall. Cytomegalovirus infections. Relapse is the problem that occur after the post engrafted, okay, on April 2021. The infection is due to the donor have positive for CMV. Okay, the CMV purposely the patient received from the previous donor. So when the donor have a positive of cytomegalovirus, so when they make a post MUD process, so it being infected. Okay, the CMV PCR titer was made and show increasing trend. The current issue after the post MUD, the patient developed hemorrhagic cystitis with secondary to cytomegalovirus reactions and also BK virus. Alright. Next, hemorrhagic cystitis is considerable cause of morbidity associated with prolonged hospitalizations and urinary obstruction. This is why the patient expressed painful at lower abdomen at the emergency department, and the BK virus has been postulated to reactive from the latent state in immunocompromised patients in the etiology of hemorrhagic cystitis in post-MUD patient. Okay, so before this, BK virus memang dah ada dekat dalam badan dia, but then because of she is the immunocompromised patient, so dia keluar lah. Okay, the BK virus exhibited and become infections. Okay, so the proposed pathogenesis of BKV related to hemorrhagic cystitis. First, because of the chemotherapy and irradiations, and then second one is the BK virus replicates, alright, during the immunosuppressive phase, and the body damage the urothelium after hematopoietic reconstitution. So this is basically the suspected why the BK virus happens to occur to the dialysis patients. Other complications that occur post-MUD was Klebsiella pneumonia isolated from the femoral catheter, and the organism able to be isolated from blood culture, aerobic and anaerobic bottle. So when the enterobacterales develop resistance to the group of antibiotics called carbapenems, the germs are called CRE. Okay, CRE are difficult to treat because they do not respond to commonly used antibiotics. So this is why the further investigations to IMR need to be done, because all the antibiotic sensitivity cannot be done in the routine lab. Okay, because CRE is basically resist, okay, to group of antibiotics called carbapenems. Next, the patient have the history of Trichosporidia assachi with pneumonia on October 2020. Since the patients have acute myeloid leukemia, this make the patient immunosuppressed, which typically susceptible to infections by every day. The patient had been required medical ventilation for 5 days and treated with 7 weeks of antifungal, caspofungin, M4B, and voriconazole. Okay, on December 2020, physicians performed CECT thorax and resulted normal lung fill. Okay. Next, move to the conclusion. Dialysis patients are more prone to infections due to the weakened immune system. Kidney failure itself weakens the immune system. So the kidney plays a role in filtering waste and toxins from the blood, and when they are not functioning properly, toxins can build up, affecting the body's ability to fight infections. Last but not least, dialysis patients have repeated access to their bloodstream through catheters or vascular access point, and multiple infections in this patient might increase the resistance to certain antibiotics. So this is all about the patient's case study, and thank you.